Good evening. I'm Yvonne, staff for Science for the Public, and I welcome you to tonight's Contemporary Science Issues and Innovations program. One of the major issues of this era is the health impact of urban air pollution, and we're very honored to hear from an expert on the subject whose contributions in both research and policy are outstanding. Dr. Jonathan Levy is professor and chair of the Environmental Health Department at the Boston University School of Public Health. He's also co-director of the Center for Research on Environmental and Social Stressors in Housing Across the Life course, which involves interdisciplinary research activities with a focus on the indoor environment and community-engaged research. Dr. Levy has served on a number of National Research Council committees and also at the U.S. Environmental Protection Agency. And he'll include in this discussion an explanation of the importance of governmental policy in addressing the problem of air pollution. We are very much appreciative of the opportunity to get Dr. Levy's views on such a significant health issue. Welcome, Dr. Levy.
Oh, thank you for having me.
And I would like to ask to start with about the issue of particulate matter, and often called PM 2.5. Could you tell us what particulate matter and that sort is?
Sure. So particulate matter is just any substance, solid or liquid, floating in the air. So it's a broad category of things ranging from dust to combustion products to coal ash to a number of things. The 2.5 part tells you how big the particles are that we're looking at. And so that means particles that are smaller than 2.5 micrometers. You can imagine you have a meter, millimeter, micrometer, so very, very small, smaller than the width of a human hair. And the reason that we talk about the size and why that matters is it affects the ability of the particles to get deep into your lungs. So a very big piece of dust, you might breathe it in, you sneeze it out, you breathe it right out. These tiny particles can penetrate those defenses, get into the lungs, and then really enter into the bloodstream and have a host of different health effects then. So whenever we try to decide about, when we do scientific research and when we try to develop policy for particulate matter, we always think very intently on how big the particles are and where they're going to go in the body.
Okay, so this basically penetrates the body, is that it? Because it can get into the bloodstream.
Exactly, it can get deep into the lungs. Once it gets there, it can enter the bloodstream, and then particles have been found in any number of different organs and locations in the body.
Okay, so that explains the great concern. And presumably, is this something new? Has it always been around? Or this is especially a problem now?
Yeah, I mean, particulate matter obviously has been around as long as we've been burning things or suspending dust in the air. Our knowledge has gotten better over time, and if you look at when the EPA first started to regulate particulate matter, which was really in the early 70s when the EPA was first founded, it started as total suspended particles, basically any particle, any size, indiscriminate. And then it evolved to looking at PM10, as the scientific understanding at the time was really focusing on particles 10 micrometers or less. As the science evolved, we began to appreciate that it was really the smallest of the small particles that could contribute to the broadest range of health effects. And then we started to regulate PM 2.5. So it's really followed the science and followed the scientific understanding, as well as our understanding of how these particles move through our bodies.
I see. Now that makes that clear. Now, what about the health effects, actually? What kinds of health effects? Obviously, makes it difficult to breathe, I guess, but...
Yeah, I mean, the respiratory effects are kind of most intuitive, right? You breathe it in, clearly it's going to affect your lungs. If you're an asthmatic, if you're someone who has chronic obstructive pulmonary disease, kind of other respiratory diseases, you're going to be vulnerable. But we've increasingly understood that that's just the tip of the iceberg. You know, for decades now, we've understood there are cardiovascular effects of fine particulate matter, and cardiovascular disease is obviously a major problem in the United States and throughout the developed world, as well as the developing world. And that's, again, because these particles don't just stay in your lungs. They can exit, they can enter the bloodstream, they can create inflammation and a host of different cardiovascular effects. And so we've really come to understand a host of different cardiovascular effects ranging from heart attacks, increased blood pressure, other effects over the recent decades. Where we're starting to gain more and more understanding now is on effects even beyond respiratory and cardiovascular, and that includes cognitive effects. And this is obviously worrisome as we're in an era with increasing rates of Alzheimer's, as well as worries about cognitive effects in children.
Right.
You know, these particles that can go everywhere, they can get into the brain
So
as
they
well.
do.
And so that is something that is of concern, and evidence is starting to show effects on things like cognitive decline from exposures to air pollution. There's also been evidence of effects on very young children and on pregnant women and the newborns, who are born. So effects on things like premature birth, birth weight, a host of different measures that reflect kind of the health of the pregnancy and then the health of the child after they're born. And so you can imagine if an exposure affects something like birth weight or something like being small for your gestational age, that can have effects throughout your life course. So these are effects that would last potentially for many, many decades.
Right. What's interesting from what you say is that you can really differentiate here that the air pollution is very significant in causing certainly asthma, but a lot of these other things.
Yeah, I mean, there are at this point, thousands upon thousands of studies. Particulate matter is probably one of the best studied environmental exposures we have ever had. So the evidence base is quite strong. And it's looked at through a variety of different kinds of studies, which helps to just strengthen the arguments and strengthen the evidence base. So, for example, there are studies that look at day-to-day changes in air pollution and what that does for day-to-day changes in things like hospital admissions, for example.
Yeah,
so
I see.
air pollution goes up today, what's going to happen tomorrow and the next day? And those kind of studies have the advantage that the only things that could explain that association would also have to change on a day-to-day basis.
Okay.
So smoking can't be the culprit
Right,
because
right.
people don't start smoking one day, stop the next day, and then
Yeah,
start again the
right,
following day.
right.
So there's a narrow set of things that could explain the effects, and through a lot of statistical approaches and otherwise, those have been ruled out. Similarly,
Okay.
there are other studies that follow people over time for many decades,
Okay.
see when they develop disease and look at air pollution, and then also have advantage of information on, are they smokers, what's their diet,
Right.
what are other factors that can influence their health, and then they control for these sorts of things and determine the effect of air pollution. There's also a number of different studies, not in humans, but in animals and in other test systems that can help to corroborate the things that we observe in people and help us to figure out mechanisms. And so all these create different pieces of the puzzle that come together and give you a pretty strong sense of what does particulate matter do to people and why does it do it.
So you're pretty assured. And then backing that up seems to be in the general press, the studies that indicate that if you get rid of this, greatly, significantly diminish the air pollution, you see a very rapid recovery rate of a lot of these diseases or conditions that you're associating with the air pollution. So that seems to be a supportive right there. It was a surprise to see that.
Yeah, no, there's a lot of great studies and things that take advantage of natural experiments, times when air pollution happened to be lower because of some naturally occurring event, and they demonstrate these quite substantial health improvements. For example, there's a famous study during the Atlanta Olympics when there were a lot of restrictions on people driving and so forth. Air pollution got better in those days. Hospital admissions and asthma attacks went down for a week, and then they came right back up. So quite a good sense that when we improve the air quality, we can have very immediate effects. Now, some effects for some of these chronic health outcomes take longer to manifest. So there's
sure.
some things that might take a year, take 2 years,
Right,
but
right.
that's the important thing, is that you do start to see health improvements almost immediately upon cleaning up the air.
Right, that's really an amazing thing. I was thinking also of the situations in cities like Houston, where you have these chemical factories in everybody's backyard, it seems like, and they frequently have these terrible accidents. And so you have a unique kind of pollution there. Do you include that in this kind of a problem? Is that something that would subside very quickly if you could get rid of that kind of pollution?
Yeah, so it's something where in these health studies, you're relying on really the observational record of
Okay.
what happened. And
Yes.
so a lot of these studies span many years,
Oh,
a decade
yes,
or more.
okay.
So if there are events that occurred during that time period, that's all part of the record. And so, really the full set of activities are looked at. Sometimes if there's an extreme event,
Yeah.
you can see the immediate
Okay.
response. Sometimes in the studies, they sort of separate those out as unusual moments and
Right.
unusual events. But, broadly, each city and each community has its own set of environmental challenges and air pollution exposures. Some places are really traffic dominated, others coal-fired
right,
power
right,
plants,
right,
maybe
right,
those sources,
yeah.
others it's industrial sources, and that's part of what makes this both interesting and challenging, that they all may contribute to particulate matter, but they may contribute in different ways.
Right.
And when I mentioned at the beginning, particulate matter is defined by its size. There's a host of different chemicals within that
understand.
that might have different kinds of health effects, and so one community might have certain compounds and other might have other compounds, and scientists are trying to tease apart if there's differences in the effects depending on where you are and what kind of particles you're exposed to.
And which brings me to the next thing, is that you do these very broad studies, you do it in a complex fashion. How do you go about studying this?
I mean, there's a lot of different approaches and strategies, and there's studies from large to small, and I think you kind of need all of them in your armamentum to
Understand.
really understand the effect. So the largest type studies rely on either existing cohorts or administrative data sets. For example, there's great studies of the Medicare population, and that's everybody on Medicare in the United States. So almost the entirety of people aged 65 and
veterans, I
older.
guess, or
yeah, exactly.
whatever,
There's good
right,
studies
yeah.
of veterans. So there's studies like that where there are many hundreds of thousands or millions of people, and the task is to figure out what is their air pollution exposure. So these studies rely on measurements on the ground, satellite imagery, atmospheric models, a whole host of data that are then pulled together to come up with the best estimate of what the air pollution level was at someone's home over many years. So that's kind of the largest scale study. And then you can shrink it down to a very small scale study that involve a small number of people that you follow over time very intensively. So you might just follow them for a week or two, but you've outfitted them with their own personal air pollution monitor that measures air pollution continuously, maybe a device that's measuring their heart rate or heart rate variability, and so you can look in real time. This person got into their car to drive to work at 8 a.m. We could see their air pollution exposure goes up. What happens to these physiological markers? And so each of these kinds of studies is valuable and important, and you couldn't outfit hundreds of thousands of people with their own air pollution monitors, so you need a different strategy for the big studies than the small studies, but they all tell you a little bit about how people are exposed and how those exposures can lead to health effects.
Okay, so this tells us like the data set, who you look at, and I presume that those are different age groups, different populations, different socioeconomic groups, and so on. Do you find anything distinctive that comes to mind? Like I was thinking like socioeconomic groups or children or whatever. But
Yeah, I mean, you see vulnerability across a bunch of different dimensions, right? So we're all exposed to air pollution,
Yes,
so
right.
it's ubiquitous. We all have exposure, and there's none of us that are immune to the effects of it. But we certainly see heightened vulnerability among the very old and the very young for a variety of reasons related to disease status or just, for young children, their size and the amount of air they're bringing in, their developing bodies, their developing brains. So we see it certainly at the young and the old end of the spectrum. We certainly see effects in those who have a number of different pre-existing illnesses like asthma, cardiovascular disease, other respiratory diseases. And you do see effects that cluster disproportionately in low-income populations, and this is for a number of reasons. One, you may have greater outdoor exposure, and some of our studies in Massachusetts and other studies nationally have shown that there are disparities in outdoor air pollution exposure. And then you may live in homes that tend to contribute to greater indoor air pollution. We all spend much more time indoors than we do outdoors, and so that might exacerbate the disparities and contribute to the effects. And then layer on top of that, access to health care or other factors that may be disproportionately distributed, and you can have fairly large disparities in those health effects. That's kind of more with a domestic lens and thinking about patterns in the U.S. I'd be remiss if I didn't say, the levels of air pollution in places like China and India are much, much greater. And so when you look at those who tend to be affected by air pollution globally, it tends to be in the developing world, and there are certainly subpopulations there that tend to be especially exposed and vulnerable, including women who are exposed to cook stoves in homes that are burning dung and other fuels, who spend a lot of time in those small enclosed spaces and have extremely high levels of exposure.
Yes. You are like one of the few people that I've seen that talks about indoor versus outdoor. Could you please tell us about that? You've done work on indoor versus outdoor type of pollution or solutions. Can you give us an idea?
Sure. So I've done a lot of work over the years, as have many others, on indoor air pollution, and can think about it a few ways. As I mentioned before, most people spend 90+% of their time on a given day indoors. So right there, you can think, this is where we're getting most of our exposures. And then if you're living in a home that has a source of air pollution in it, which could be secondhand smoke because either someone in your home smokes, or you're in an apartment, someone in the apartment next door smokes, using a gas stove for cooking, there's a litany of things that can contribute to indoor air pollution. It turns out that can elevate your exposures well above and beyond what's in the outdoors. And so, having a gas stove in your home that you utilize frequently could give you far greater exposure than, even being outdoors and moving from a suburban to an urban setting. So it matters quite a bit for exposure. The other thing from the positive side is it's something that has possible solutions and remedies to it. And so obviously we can clean up the outdoor air, but on an individual basis, there are actions that you can take in your home and around your home that can have outsized benefits. So it's appealing for all those different reasons. Now, one other thing to say that's important is that if you're thinking about your home and your exposures, the outdoor air does penetrate inside. So what you're being exposed to in your home is a combination of what comes in from the outdoors and everything from traffic and coal and oil and everything else, and what you might generate inside your home environment.
How about these old filters in buildings, libraries or office buildings or any kind of a building, especially old ones, where sometimes when I don't know whether it's the filter system, whatever, blows, people start sneezing and so on. Is that an issue also, that it's something they can remedy?
Yeah, these kinds of filtration systems, if they're maintained well, cleaned well, and using the most advanced technologies, actually have a great benefit and potential to clean up the air. Obviously, a poorly maintained system can have a host of different problems, but that's where, again, there's outsized opportunity with well-designed and well-run ventilation and filtration systems to lead to a much cleaner indoor environment, and potentially an indoor environment that feels better, maybe the temperature control's a little bit better, and if you do it right, hopefully a more energy efficient system too, so you're saving money. So I think a lot of what we've tried to think about in some of our studies is trying to be holistic and thinking, if you're doing an intervention in a home, how do you think about your energy bills and the health of the people inside the home and the health of the people in the community all at the same time.
Right. It sounds from what you're saying that there are remedies, that you don't have to pile an enormous amount of money into it or anything, but that the information exists, that a lot of people could clean up this indoor air wherever they are. So that's a distinct possibility, even if we have the outside one at the time. Are there other aspects of the way that you go about analyzing these things that we should know about? How people like you work?
Yeah, no, it's a good question. I mean, if you're thinking about the indoor environment, right, obviously it's, people have different sets of activities, different activity patterns, and it can be hard to characterize for a large population. And so we try to use a variety of different techniques. Sometimes it's going into homes and taking measurements and administering surveys.
Okay.
And so that's a part of it, is actually getting into the home, having people willing to have an air pollution monitor in their home and tell us about what they're doing and when they're doing it. We also try to utilize geographic data wherever we can get it about characteristics of buildings, where people live, trying to compile all that information to help us to better predict which homes and which types of homes might be most vulnerable to these health effects and where you might want to intervene first. So like with other kinds of studies, it's, we try to use a whole host of different techniques, sometimes, again, going in the homes, usually engaging with community partners to facilitate that, and so we can work together to design solutions, and then using these large-scale spatial databases that can help us understand the buildings, the green space, the built environment, all the other parts of our municipal infrastructure that can make a difference.
That's interesting that you bring up the community engagement part, because that's a kind of win-win situation. It sounds like you're able to get a lot of data, and at the same time you're really able to put your expertise to practice for the general public, and I'm sure it's very much appreciated. Yes?
Yeah, I mean, there's certainly a lot of communities that are worried about air pollution or worried about environmental exposures around them. There's a lot of communities that are worried about housing, either quality, quantity, affordability, or all the above. And so, what we try to do is enter into partnerships where possible, where we can do research that helps out, that tries to answer questions that communities want to have, and then hopefully deliver it in a way that is informative and meaningful, so that we're doing our research and the things we need to do as academics, but we're not just doing ivory tower work that doesn't connect at all. And the community partners help us to formulate the questions, implement the research, and then help to think on the back end about what you do with all that information and how it makes a difference.
Right. It just sounds very laudable, because it's another way, it's a very good way of informing the public as well, and you learn more if you're kind of participating in something, so it works very well, I'm sure. I'd like to shift in our last few minutes to your work on these committees. What do you do, and how do you get that information out?
So, broadly, I mean, I and a lot of other academics in the environmental health space, generally like to serve on these advisory committees, whether it's, the National Academy of Science sometimes convenes panels of experts to try to address difficult questions and inform government agencies about, strategies to take and what to do. The U.S. EPA also, has historically convened similar
Protection Agency.
Yes, exactly. Convened panels also as experts to help to guide them in decision processes about, to what level should we regulate fine particulate matter or other pollutants, or, if we're trying to understand the health benefits and costs of the Clean Air Act, how should we do that? And so trying to get guidance from experts in the field to inform the decision process. And so that, I think historically has been a very valuable thing for both the researchers and the government agencies. It lets us better understand what is happening in the real world, what decisions have to be made, so our research is better grounded, and hopefully it helps the agencies as well to understand the current state of the science and get some outside perspectives. So that has certainly been greatly curtailed in recent years, which is disappointing. So I think there are a lot of people with really good expertise and a desire to do public service to really help out the country and try to bring the best information forward that can protect the public's health. And those perspectives are not being included in the decision process.
Right. I'm not sure how well, how familiar this is to the public today, but the organizations like the Environmental Protection Agency are responsible for, water, air, all kinds of regulations, and they depend on experts like you and also scientists actually working in those agencies. And this seems to be eroded seriously in the last few years. Before this period, was your impression, because you have a long history with this, it was your impression that they do take the advice and try to implement reasonable regulations?
Certainly, and I mean, regulation setting and these other things are clearly partly political processes.
understand
and so,
that.
I wouldn't want to be a naive academic and
Right.
say that the science always
Right.
drives the decision, but the science always informed the decision. And
Yes.
so I think that was key, that the information was taken seriously. The most recent knowledge was brought to bear, it was really grappled with, and then a decision was ultimately reached that weighed the state of the science with all the other factors that the agency is permitted to consider in any given decision. And so I don't think I would ever ask any, federal agency to say that whatever I think
I
should go,
understand.
but I
Right,
think
right.
they should take the current science, the expertise that exists, not just in academia, but in state government and consulting firms and nonprofits, bring all that expertise to bear and let the evidence dictate the direction that one could take, or inform at least the direction
these
one
kinds
should
of
take.
policies. And this is an important thing because, the issue with particulate matter has gone on for years and years and years, and they've known that it affects small children and on, but it's hard to see whether anything is actually happening. And in the last few years, it may have gotten more serious, that it's being gutted, basically. I don't know if you can speak to that at all, whether what the effect will be if people leave these agencies or if the experts are ignored.
Yeah, so I could speak to that maybe in two directions. So the first is, does this matter for health, right? And so, there have been studies out of the World Health Organization, just to kind of cast the broadest net, that show that, somewhere on the order of 4 million people per year die globally because of exposure to outdoor fine particulate matter.
That could have been avoided.
Exactly, and if you incorporate exposures to indoor cook stoves and other things, the number gets closer to 7 million. So this is a serious public health challenge globally. And not all of that is in the U.S. certainly, but the
Right,
U.S. has
right.
its fair share of impact. So it's a big challenge and it's a big problem, and so we need to use all the tools that we have to try to address it. Now, there have been data that have come out recently that show that air pollution, which for decades has been on the decline in the U.S., it's one of really the landmark success stories we have, that with the Clean Air Act and a host of other things, pollutants like fine particulate matter have gotten much, much lower
I see.
since the early 1970s to the present time. And so that's been an enormous public health boon for the population. That trend line has leveled off, and the recent data show that air pollution has gotten worse in the past 2 to 3 years. And so that's concerning for something that is, killing, by any estimate, many tens of thousands of people in the United States each year, not to mention asthma attacks, premature birth, cardiovascular effects, et cetera, et cetera. So, we're heading in the wrong direction on policy, but we're heading in the wrong direction just on our exposures to air pollution. So one would hope that we are taking actions as individuals at the city level, at the state level, and at the federal level to take on this challenge to try to reduce our exposures and to improve health and well-being of vulnerable populations across the country.
In closing, what do scientists like you who've been very involved in these policies for a long while and in research, both ways, what do you feel is the most effective approach from your angle, from the scientist's angle, who must be a bit frustrated seeing all this stuff ignored, now abandoned?
Yeah. I mean, in part, it's about partnerships, and I think it gets back to the discussion about community engaged research. And I think, to really affect policy, academics and researchers have some knowledge to inform that, but a lot of times we don't have the megaphone or the connections, or we're only a small number of constituents. But if we are partnering with communities, with nonprofits, with advocacy groups, with industry groups for that matter, who are receptive to the information, we can create much stronger partnerships, and I think our voices can be heard. So I think a lot of times our goal is to do the good science, to do the research that informs the decision process, but make sure that that work gets into the hands of people who can amplify and connect it with other sets of information to really address policy.
Yes, so it is possible at a more local level to get things accomplished, even if you're having a problem at a larger national or international level. You think that is possible?
Yeah, I think so. I mean, there's a lot of different levers and a lot of different actions. And we've been talking about air pollution, but climate change is obviously a topic of great concern.
Right.
Many cities across the United States have developed climate action plans, and so they're moving aggressively, but now thinking, what should we do and how should we act to try to reduce our carbon footprint in the upcoming decades? And part of that ties back to air pollution. Right? If you take actions that are going to reduce carbon emissions from industry, from traffic, from other sources, those are also going to have air pollution benefits. So part of what we've been trying to do is understand these air pollution benefits, which, as you said, can manifest within weeks, not years or decades, and bring that information to the local level to inform their decisions and their actions related to climate. So it can all tie together, and we can help to inform the policy decisions that are already in progress.
I see. Last question. That's very helpful information. Can community groups, local government types of groups and other groups, can they contact people that are doing this kind of work? Can they get help, get assistance?
Yeah, no, I think there's a lot of opportunities. I mean, we have well-established partnerships within some specific communities, but there's any number of different ways where community groups have and can reach out to us. There's databases that have been developed of experts in different scientific domains, as well as things like environmental law, and those databases are accessible by community members and partnerships. There's other nonprofits that sort of specialize in connecting with communities and sort of being a facilitator to bridge between the communities and the academics.
Yes,
so I think there's
an
enormous number
They're
of mechanisms.
Not isolated. I think at an individual level, we tend to feel very isolated and then discouraged. But the way to do it is to be a little more aggressive and go after the solutions, and the solutions are sort of there. I mean, you can just be creative with it, and you can access the experts and the expertise.
Yeah, no, I think so. Again, I think there's levers at the building level all the way up to the federal level, and certainly including cities. And there are a lot of academics at BU as well as elsewhere who are eager to help out and eager to try to inform solutions and help to implement those solutions.
Yes, that department. Yeah, I mean, the BU School of Public Health is very well known for that outreach. Thank you very much for that.
Thank you.
And Dr. Levy, thank you very much for all this wonderful information. Best of luck with all these studies.
Oh, thank you. Thanks for bringing attention to this important topic.